When we breathe, air travels through our nose, down our trachea, and into smaller and smaller airways. The inside of our nose is lined with tiny hairs called cilia that are meant to trap foreign particles from entering our bodies. Sometimes these foreign particles get past the cilia and enter our sinus cavities, which are air pockets inside the bones of our skull. Our sinus cavities are equipped with mechanisms to push mucus through them as well. Cilia lines the sinuses to help drain mucus, and a short hairpin-shaped tube called the ostium allows for drainage. If the cilia is unable to push the mucus through and keep it from collecting in our sinuses, blockage can occur, causing swelling of the membrane lining. Symptoms of sinusitis might include facial pain or pressure, nasal obstruction, nasal discharge, and dental pain. Over-the-counter and prescription medicines can help alleviate the symptoms of sinusitis, but long-term sufferers may require surgery.
When we breathe, air travels through our nose, down our trachea, and into airways called bronchi. The bronchi divide into smaller bronchioles, and finally into tiny grape-like clusters of thin, fragile sacs called alveoli. The alveoli are where oxygen is exchanged for carbon dioxide in the blood. People who work in mines or quarries, or with substances such as concrete or glass, run the risk of inhaling small particles of silica dust. These tiny particles travel through the smallest airways into the alveolar sacs. Inside the alveoli, the silica particles are engulfed by immune cells called macrophages, which are designed to destroy foreign invaders in the body with special enzymes. The macrophages may then move from alveoli into the lung tissue or into small veins that lie near the alveolar sacs. Unfortunately, instead of the macrophages destroying the silica proves lethal to these immune cells, which release their enzymes as they die. At this point, special cells called fibroblasts move in and begin to build a wall of fibrous tissue around the particles, forming nodules of scar tissue in the lungs. This eventually reduces the exchange of oxygen in the lungs, causing shortness of breath that progressively worsens. Other symptoms include chest pain and a harsh, dry cough that may produce blood. It sounds a lot worse than it is, but an upper respiratory infection is another way of saying you have a cold. A cold is a minor infection of the nose and throat. When you breathe, air travels through your nose, down your trachea or windpipe, and into smaller and smaller airways. There are several mechanisms in place to prevent foreign particles from entering your nose and making you sick. One mechanism is mucus, which coats the inside of your nose and traps unwanted germs that might enter. Cilia is another. They are tiny hairs that push out harmful particles trapped in the mucus lining. If harmful germs slip by our defense mechanisms and wind up further down in the respiratory system, they can enter the alveoli, where white blood cells try to fight off the unwanted invaders. Upper respiratory infections can be spread by direct contact, by exposure to airborne particles, or by touching contaminated surfaces and then rubbing your eyes and nose. Often, spores from molds such as Stachybotrys or black mold become trapped within wall spaces during construction, where they may lay inactive for many years. However, accumulated moisture from flooding, leaks, or high humidity can activate these dormant spores, causing mold to grow and reproduce. Black mold reproduces by creating spores that carry harmful chemicals called mycotoxins. The spores are released into the air where they circulate and may land on household surfaces. Mycotoxins that come into contact with our skin may cause irritation and lesions. If inhaled, these toxins travel to the lungs and infiltrate the air sacs. This inflammation makes breathing difficult and painful, a condition that is only worsened as fluid begins to accumulate. Mycotoxins that have fallen onto food products may be ingested, inflaming the entire digestive system. Through any of these pathways, these dangerous mycotoxins may find their way to the network of blood vessels that nourish our brain. Once inside an artery, they may travel out of the bloodstream and enter the nervous system. These toxins affect the passage of signals between brain cells, causing disruptions in thinking, memory, and movement. Households that have been exposed to moisture should be tested for the presence of mold, and new homes should be built with appropriate measures for reducing the potential for moisture accumulation. Often, spores from molds such as Stachybotrys or black mold become trapped within wall spaces during construction, where they may lay inactive for many years. However, accumulated moisture from flooding, leaks, or high humidity can activate these dormant spores, causing mold to grow and reproduce. Black mold reproduces by creating spores that carry harmful chemicals called mycotoxins. The spores are released into the air where they circulate and may land on household surfaces. Mycotoxins that come into contact with our skin may cause irritation and lesions. If inhaled, these toxins. Our lungs are sponge-like organs that are divided into lobes. The right lung has 3 lobes and the left lung has 2 lobes. The reason for this is because the heart is situated on the left side of your body. When we breathe, air travels through our nose, down the trachea or windpipe, and into the bronchus. From here, it branches into bronchioles and then into smaller and smaller airways that end in air sacs called alveoli. It is at these sites that oxygen is exchanged for carbon dioxide. In lung cancer, most tumors grow in the lining of the bronchi, but can also begin in the trachea, the bronchioles, or the alveoli. Lung cancer is the leading cause of cancer deaths among men and women, but the most alarming news is that more women will die of lung cancer than breast cancer. Your voice is actually sound that is made as air passes through your larynx or voice box. When you inhale, your lungs fill up with air. Then as you exhale during speech, the air travels up your trachea or windpipe. As the air enters your throat, it passes through the larynx, which houses your vocal cords. The movement of air through your larynx causes the cords to open and vibrate, generating sound which is further refined by your mouth. Laryngitis is an inflammation of the larynx and vocal cords that is often due to infection by the same microbes that cause colds and sore throats. However, laryngitis can also be caused by allergies, smoking, and straining your voice during excessive shouting or singing. Regardless of the cause, the primary symptom of laryngitis is hoarseness or loss of voice. If you experience laryngitis, you should try to drink lots of fluids and use your voice as little as possible by whispering or not talking. In addition, room humidifiers and hot showers can help. With or without treatment, laryngitis usually subsides within 7 to 10 days. When we breathe under normal conditions, air travels through our nose, down our trachea, and into smaller and smaller airways called bronchi. The bronchi divide into bronchioles and finally into grape-like clusters of thin, fragile sacs called alveoli. The alveoli are located where oxygen is exchanged for carbon dioxide in the blood. Inhaled toxic vapors, such as those found in cigarette smoke, can lead to emphysema, an irreversible disease that jeopardizes our lungs' ability to function. At first, the alveoli are destroyed, resulting in holes in the tissue of the lower lungs. Those holes lead to collapse of the bronchioles, keeping airflow out of the alveoli. The exchange of oxygen is reduced, causing shortness of breath that progressively worsens, causing damage to the lungs and the heart. Cystic fibrosis is a genetic disease that alters the body's respiratory, digestive, and reproductive systems. It affects the body's epithelial cells that make up the lining of the lungs, pancreas, liver, sweat glands, digestive tract, and reproductive system. Normally, the epithelial cells release a slippery layer of mucus that captures dust and germs and acts as a lubricant. A person with cystic fibrosis inherited a gene that causes the epithelial cells to produce a defective protein. That protein leads to the formation of thick, sticky mucus, which causes many serious problems. It can clog the bronchial tubes, interfere with breathing, trap bacteria in the lungs, and interfere with digestion and absorption of nutrients, which can stunt growth and weight gain. Common symptoms of cystic fibrosis include very salty tasting skin, persistent coughing, poor weight gain, and bulky stools. Treatment of cystic fibrosis varies according to the stage of the disease and which organs are affected. When you breathe, air travels through your nose or mouth, down your trachea or windpipe, and into smaller and smaller airways. In normal, healthy lungs, air moves in and out with the help of several muscles. One set of muscles that we'll talk about here are the tiny muscles that surround your airways. If you have an asthma attack, these tiny muscles may constrict, and the membranes that line the airways can swell until the airway is narrowed or blocked. During an asthma attack, the person can inhale but has difficulty exhaling because the airways are too tight, air gets trapped in the lung, and fresh air cannot enter. During harsh conditions, the large rod-shaped bacteria that cause anthrax develop into spores that can be released into the air and inhaled. Inhaled spores are swept into the trachea, which divides or branches into the bronchi. Because of their small size, the spores are carried into smaller and smaller bronchioles, eventually reaching the tiny alveolar sacs of the lungs. In the alveolar spaces, immune cells called macrophages engulf the spores and attack them with enzymes. Although some spores are destroyed, many others survive the immune attack. The surviving spores travel through the lymphatic system and accumulate inside lymph nodes in the chest. After a period of time, the spores will germinate and grow into full-fledged anthrax bacteria, which replicate within the lymph nodes. As these bacteria multiply, they produce harmful toxins that cause the lymph nodes to swell and hemorrhage. The toxins also travel through the bloodstream, rapidly producing the dramatic symptoms of anthrax. Within a few days after the initial exposure, cold-like symptoms including fever, cough, aches, and general malaise develop. Although some people experience a brief recovery, this is followed by a rapid onset of more serious symptoms. During this time, sores develop in the lung tissue where the bacteria first entered the body and fluid builds up within the chest cavity. This produces bleeding and swelling that restricts breathing. The toxins also reach the brain and spinal cord, causing bleeding within the thin layer of tissue that encases these structures. The results are severe respiratory problems, hemorrhaging, shock, and often death. However, these dire results can possibly be avoided by taking the anthrax vaccine prior to exposure or by taking antibiotics such as penicillin or Cipro shortly thereafter.